Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson, as always, joined by the RipsyTech founder and CEO, Tom Tarshis. Hi, Tom.
Hey, Parker. Happy New Year.
Happy New Year. Keeping you on your toes on whether we include adjectives or not. I think I've just decided if I don't have one, I'm just not going to do one. So it's been a while since we've recorded an episode.
Yeah, right. It's been maybe 3 weeks or so.
Yeah, so bear with us if we sound rusty. I don't think we will be, though. For today's topic, you messaged me yesterday with this interesting topic about expanding your services as a clinic into a new state. And we haven't really talked a whole lot about what sprung that thought or where that idea came from, but I put some questions together for you. But before we begin, do you want to kind of start with, why this topic? Why might somebody want to be doing this?
Yeah, no, great question. And I think, in general, there's lots of companies that, span the entire United States and expand the whole globe. And so as a mental health practice, in general, things tend to be maybe more localized into a couple branches in one city or maybe statewide. But these are businesses. And so on some level, as a quote, pure business person, hey, if you can expand everywhere, then that's awesome. And it means your business is doing well. My interest in sort of national reach came a very long time ago when I just finished training and was part of a group that was going to try to bring child mental health services throughout the entire United States because there's such a desperate need everywhere. And so it was sort of more out of a public health mission that interest initially developed, more than 15 years ago. But, that initial group, for lots of reasons, including complexities of doing stuff across state lines and keeping, how do you keep leadership and other people invested in the same vision? That group didn't last. And however, that's when my first interest came in, how do we address something with such a huge public health crisis? And that is also very fragmented. And in a perfect world, it would be, well, let's get great clinics up everywhere around the country where people could get the same excellent care and get their services for reasonable prices. And man, wouldn't that be great, revolutionary? And unfortunately, for lots of reasons in the US around just basic requirements between states. For example, every clinician, instead of getting a federal license to practice, you get a state license. If you're a social worker right, or MFT or a psychologist or a physician, it's state. There's other different requirements on businesses in different states. And so there's a lot of complicating factors if you do decide to have a business that spans different states. That being said, where I'm on the West Coast here, and because of that, and because of a good friend who lives in the state of Hawaii, and because of my public health interest, I've always known that Hawaii and Alaska actually things are bad all over for youth mental health, but they're really, really bad for getting help in Hawaii and Alaska. So and I've known psychiatrists who've gone to do some work in Alaska, and I know other consumers and friends in Hawaii with kids that they've just been unable to get mental health services. And it's finally reached a point where there's some other possible synergy with good people I've met in Hawaii, where we're going to see what we can do to bring our nonprofit services to the state of Hawaii. And just yesterday, I mailed my Hawaii physician application in, which is kind of a good thing to just go ahead and do first, because that's going to be, I'd be shocked if that happens in less than 3 months. But so I get the ball rolling on that piece. Yeah. And then I thought it'd be interesting to maybe bring the podcast listeners along on, the pitfalls and struggles and maybe occasional happy surprises that happen along this journey. Sorry, I sort of soapboxed it a little, but
no, that was all great. So, so I think I actually want to start with first answering the question around, you're applying for your state license in the state of Hawaii. So, as somebody who's licensed in California, you can't legally see somebody in Hawaii unless you have a state license there. Now, if I'm correct, that also means if you are licensed in the state of Hawaii, that you could provide telehealth services from California to somebody in Hawaii?
That is correct. So it is this, you don't actually need to be physically present to deliver services to the state, as long as you're licensed in that state. So, if the whole venture fails to actually get clinics established throughout the state of Hawaii, it still does leave the door open for me personally to see patients in Hawaii via telehealth.
Yeah. So either way, it is a benefit to you.
Yeah, and the one nice thing about the Hawaii medical license is it's about less than half the cost of the California medical license. So when I saw I think I was pleasantly surprised to see it wasn't the 1,000-ish check for 2 years of a license in California. I think it's more like $220 a year in Hawaii, or something like that.
All right.
But yeah, so it's not, whatever happens, it will be helpful to have a Hawaii medical license.
Yeah. Okay. So we are talking about this in, from a frame of expansion. So, with an expansion, I assume that comes with its own costs, its own, if you're going to be taking insurance, talking to the insurance companies that operate in that state, and maybe even staffing. I guess it depends on whether the services are being provided either through telehealth or in-state. So, yeah, I imagine there's a lot of financial and logistical considerations. So, as somebody who's going through that, what might some of those be?
Yeah. And, this is also spurred a little bit. I think we may have talked about this as a business moment, but, we sort of figured out there's a few of these states that have a different state tax structure for businesses than
Right.
we were used to, as we found out from some of our EMR work. And so in general, asterisk, I don't know all the answers to that question. However, the advent of telehealth has made it maybe easier to get started. So, from a very basic level, once I'm licensed to practice in Hawaii, the only things I would need to do are, number one, make sure my malpractice covers me for seeing patients in Hawaii. And if I need to pay a little extra or get that in place. And then number two, any income that we receive from someone in Hawaii, make sure we are taking care of the appropriate whatever's due to the state from earning income in that state.
Okay.
And this is something we'll have to kind of learn state by state. I think if you're doing any business that sort of derives revenue from more than one state, you have to do some reporting around that, and make sure that you're not, you don't want to get in trouble for not paying the taxes you're owed to any given state. But those are really the only two things I fully need to look into.
Right. So just kind of thinking out loud based on what you're talking about. Yeah, it sounds like one could realistically get licensed in another state that they want to be operating in, go through the go through the few hoops that you just mentioned and start operating in a telehealth capacity, and really just get started, and then from there assess whether they need to do anything with like an in-person clinic or anything like that based on demand. Yeah, very, very interesting, and I think that's certainly something that the post-pandemic world has changed for the landscape.
That's true, and that's a positive piece in that you can sort of get your foot in the door with minimal risk and actually kind of minimal effort. That being said, I think my save the world mentality is no, we want to have clinics on the ground, and we know in-person visits are very important for kids and also important for lots of adults. So we're going to do much more than what I mentioned.
Mm-hmm.
And, we have like-minded people in Hawaii who are maybe interested in being part of what we're doing, so that the first steps are to meet with people and see if there's shared vision, and you can bring other people onto your team that are on board with what you're doing. This is a nonprofit entity, which, on some level, we have our federal nonprofit designation. So getting your nonprofit status is a federal issue.
Mm-hmm.
You still need to do stuff to then register as a nonprofit entity in other states, and there might be hoops or issues related to making that happen in Hawaii. In general, we know that Hawaii is notorious for having extra delays or some extra bureaucracy, or for doing things a little bit different.
Mm-hmm.
And so, step one is going to be, is there good synergy to find a partner there? And step two is, okay, do we need to do something statewide around the nonprofit designation? So that's going to be, at the top of the list. Close behind then is, we want to accept insurance and hopefully even Medicaid. And those are big delay factors. So we've got to look at the payer mix in Hawaii, which we actually have been doing by virtue, again, of some of our other work. Mm-hmm. And then we need to start some contract negotiations and see if we can get reasonable rates there. And as we've talked about on the podcast, one of the biggest struggles in running your business and planning your budget is, okay, what is the best reimbursement and revenue we can make? And then that sort of determines how fast you can grow, how fast do you have money to pay for rent, how fast can you hire staff, do you get enough money to actually pay staff decently that they want to come work for you? And that will all be upcoming.
So, yeah, you've touched a lot on, in your experience of expanding your services to Hawaii, you've touched a lot on some of the knowledge that you already have in terms of the demand for services there. You've done kind of some of your own research. So I'm wondering, for somebody else who might be not expecting, but hoping to expand into a different state, what are steps they can take to kind of assess for if an expansion is viable there? And then second part to this question is this, and this is just me being curious, what is preventing somebody from getting licensed in every single state and accepting clients from every single state?
Yeah, well, to answer your latter question first, so there are big telehealth groups that if you sign up for them, they will go ahead and get you licensed in every single state,
Oh
so
wow.
that and bring you clients from every single state. Um, and so you can do that if you were so to do my Hawaii application, and I tend to be pretty organized and efficient and have stuff on hand, but it still took me, God, at least 4 hours. And yeah, I had to pay a little bit extra to get old test transcripts and medical school stuff. So, 4 hours, a few $100 times 50, that's more
Right.
than people really want to do.
It's like
However,
5 weeks of full time work, nonstop.
but if you're a huge company and you have 10 people in charge of credentialing and you say, we'll take
Yeah.
care of all of that for you, and that's when you'll see people who are licensed in lots of different states, is by having other credentialing teams that can do that for you. And fortunately, I have a contact that is an expert at the credentialing piece, and I'm happy to do it for myself. But it's not a good use of my time to get other people credentialed, but it could be a more efficient and cost effective use of a credentialing person's time. I think back to your first question, there's a good mental health clinician in a small, you don't really need to expand into another state to fill your practice. So I think it comes from, Parker, you're in Virginia.
Hmm.
Washington, D.C. is not another state, but it is another entity. But
Hmm.
if there's a connection, if you're very close to a geographic border, if there's some other
Mm.
draw to a different state, and I think having a feeling about wanting to be in another state is maybe the first piece. Another piece that we have experience with is that if your schedule works better to see patients in a different time zone, for example, if you want to be done at 3 p.m. so you can pick up your kids from school and you live in New York, hey, get licensed in the state of, I have that
I
backwards.
think you have it
If you,
reversed. Yeah.
yeah, if you live in California, if you want to work when your kids are asleep in New York, get your California license. And if you want to be done to pick up your kids from school and start earlier,
Right.
in California, I could get my New York license where 3 p.m. is 6. And so there are some time zone advantages to doing that. But I think it's, telehealth wise, you don't need to necessarily do anything with a physical location or something like that. But I think the more fun and interesting piece is, yeah, if you're going to have some sort of connection and you want to go and know the area and some of the people there, know where good places to set up another clinic, then in general, the more branches you have for your business, the more revenue and the more people you serve. So it's a win-win from
Mm.
both a business and a service provision side.
Okay, so let's say you do expand, and this applies to your case too, expanding into Hawaii. You expand. What's the strategy for building awareness and trust in that market, especially when you haven't been there before?
Yeah. And so, like, right, if we're going to, especially in a state like Hawaii, where there's a large indigenous population that maybe looks at outsiders, um, with appropriate caution or questioning, it's very important to establish a team of individuals who know the population you're working with and have that experience with them to get credibility. Like, I think you can lean on whatever you've accomplished in your business in the other state as, like, hey, we've served this number of kids. Here's our good reviews and our ratings. Here's how many families we've helped. And we want to do that in this other location as well, for the right reasons. In order to make that more credible, if you bring in a team that is local to the location that you're going to, that's going to help give you that credibility. And on some level, you don't even need to highlight that you're from another state or have done this before. If you're just going to go in and bring in the right team of people in the community you're in, you can decide how much to let people know about your track record or where you've been before, and be sensitive to the area that you're going into.
Yeah, well said. No, very clear answer. No follow up to that. Okay, so you stated, I think, a lot of different types of challenges and common mistakes, but I guess to just kind of put an explicit focus on that, a specific spotlight on that, what would be some challenges or common mistakes when expanding across state lines, and how can you avoid them?
Yeah, well, and again, I think the answer here is expect for things to be different in a different city, county, state government system. So just because you've figured out how to do things in one area, it is likely not going to help you know everything that's needed in another jurisdiction. So at the top of the list is, every state has a sort of doing business in our state website. That is probably the first place to go to check, like, hey, so you're opening a business in Hawaii, what is required of me? And going to the government website that sort of lists the legal requirements is going to be your source of truth to make sure that you can see what you need to do from the state level. Once you know from the state level, okay, what cities and counties are your clinics going to be in? Now, the experience in California is you don't really need to do much with the counties. You need to deal with the cities and then the state as a whole. But you haven't had to do much with getting any permissions from the county, but that could definitely be different in other states. So make sure that you're looking at those legal requirements just about doing business, any type of business in that state. And then it's being very careful about, if you are someone has a license to be a clinician in multiple states, to make sure you're not doing anything to jeopardize your license in one or both states. So each state will have its own licensing board. You want to make sure that you check with them about any requirements to being licensed in both states. And then you want to make sure, especially around your malpractice, that you're covered for all the services that you provide. I think for insurance contracts, they tend to be state specific, but that's not totally true. And there are larger agencies that can negotiate sort of a federal insurance contract. So for some insurance companies that are national or have a big presence, like Anthem, Optum, Aetna, Cigna, it is possible to negotiate a national contract. And so that will be, we have all of our contracts right now are for doing business in California. So it will be interesting. And I know Blue Cross Blue Shield has a big presence in Hawaii. Where in California, Blue Cross and Blue Shield are two different entities. So, but at least I have some contacts there that can maybe get things started with reaching out to, hey, can we talk about doing business in Hawaii? And then, and this is true for any business, it's being cautious about signing that lease. Any big cost items, wait until you've figured out that you've got a green light and understand all the restrictions and rules about doing business before you go sign an expensive lease on a physical location. And so that is a very, check yourself on how excited you are. And because you see, oh, look at this awesome clinic office with a view of the beach in Hawaii. Let me grab that really quickly. No, we're not going to grab that until we know we're ready to rock and roll.
Yeah, it's a big endeavor, so you got to be, making sure that you are committed to it. Absolutely. Okay, well, before we wrap up, is there anything else that you'd like to say on the topic before we move on?
No, I think it will be, we'll I'll sort of can keep people posted on how this process goes. It can be a slow process. The goal would be maybe by summer to see our first patient in Hawaii, but I feel like it can bring interesting information for our other clients who are growing or building or starting their mental health practice. And yeah, I'm excited to see how it goes.
Excellent. Okay, great. So, this kind of has been like one big mental health business moment, but do you have a specific mental health business moment of the week outside of today's topic?
Yeah, I mean, nothing, because it's the new year, and this is good for everyone to know this. In general, a lot of single case agreements expire at the end of the year.
That's right.
And so I've been making phone calls to get single case agreements renewed. It's been a few hours making some of these phone calls so far. It feels frustrating to me that, for some patients we just started seeing in October, I'm calling to say, hey, can we renew this? I do realize, the insurance, I did actually ask one of the agents, why this expires so quickly. And they said, well, we don't know if they're going to have their insurance with us the next year. It's a calendar year. Right. So it's like, oh, okay. But on another level, okay, if they don't have their insurance anymore, the claim would just be denied because they don't have the insurance. Do you really need to do this? Couldn't the single case agreement authorization still be extended for at least a year from the beginning? But anyway, that's what the agent told me. I'm sure that's what they've been told, and that's how the system is. But anyway, watch out if you have single case agreements, make sure they're renewed.
Well, do you also kind of run into any problems with people changing insurance policies as well? Patients changing insurances?
Yeah, great comment. And actually, been a little behind on this. Usually in December, we do a blast email because, already 3 of my patients have new insurances, which there's just going to be a large number of initial January claims we submit that are going to say they don't have this insurance anymore. And so you need to be proactive in asking patients about their insurance changes. The other thing to be ready for is those deductibles restart. So if people started seeing you in August and they had met their deductible and have been paying $20 a visit, and now their $5,000 deductible is back and they get a bill for several $100s, they may not be aware of that. But fun New Year stuff.
Always. It comes around every year. All right. Well, this has been a good episode. Let's go ahead and wrap things up here. So thank you for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. And if you have any questions to submit to an audience Q&A, send them to our email at sitandstay@ripsytech.com. And if you're interested in applying to be a guest on the show, shoot us an email there as well. All right, Tom, it's been great. I will see you later.
Thanks, Parker. Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.